Hello humans, welcome back to Dr. Rose Helps You here. I'm Stephanie Rose and I'm an audiologist. Today we're going to be talking about COVID-19 and hearing loss. I wanted to say thank you so much to all my Hearing Nerd subscribers out there. I'm almost at 500 and it really just means a lot to me that you guys like my channel and you like my videos, so feel free to comment, like, and subscribe for more content. I only found about 8 articles so far that talk about COVID-19 and hearing loss symptoms. So a quick search will only lead you to about 8 different websites. And really, when I delved into that actual research, I only found that there's really been very few reports of hearing loss in people who've had COVID-19. And I'm going to go into what those reports consist of. The two differences that we're going to look at are going to be onset of hearing loss prior to testing positive, and then also hearing loss post being released from the hospital from COVID-19. So I will get into those things, but really when you look at those different articles, it's only stemming from a few different reports. So we'll get into that in just a moment. This first article that I found is from livescience.com by Rachel Retner. This is basically a case study of a man that was from the UK, but I liked the background that she provided to this before going into the case study. So basically, sudden hearing loss is not uncommon. We know that it affects about 160 cases per 100,000 people in the population. So it does happen quite often. In the United States, we don't talk about sudden hearing loss very much. And so a lot of times people wind up at the urgent care or at primary care, and they're treated for allergies and not a sudden sensorineural hearing loss. So usually this is an onset of fullness, possibly with some ringing in the ear or tinnitus. So they're given, Flonase and other anti-allergy medications. So when the fullness doesn't go away, then they're usually referred to an audiologist or ear, nose, throat doctor for further workup, and it's discovered that they have a sensorineural hearing loss. So we do know that sudden hearing loss can be caused and linked in some cases to viral infections. So sometimes we see this a lot after people have had the flu, a really bad flu. We also have seen this with people who've had, meningitis and also bacterial infections, usually stemming from a high fever. Other viruses that can cause hearing loss include the herpes virus and the cytomegalovirus. So we know that this can happen. There have been other reports of coronaviruses that have happened before, like with MERS and also previous SARS outbreaks. And there have been no linked hearing loss associations with those particular coronaviruses. So this is a very new thing in the literature to have hearing loss linked to a coronavirus. The study that was in this report and several others that I read was about a 45-year-old man who came down with coronavirus, SARS-CoV-2 or COVID-19. So SARS-CoV-2 is the name of the virus, and then COVID-19 is the disease or symptoms that are related once you have the virus. So this 45-year-old man in the UK had asthma, got checked into the ICU for 30 days and was placed on a ventilator. He received remdesivir, which is one of the therapies for the COVID-19, and he also received some IV steroids and a blood transfusion. He got better, and 1 week after leaving the ICU, he reported that he had tinnitus and a sudden hearing loss in the left ear. The MRI that he had and blood work didn't show any other possible causes to the hearing loss, so they did determine that this was related to COVID-19. So the hearing loss that we're seeing related to COVID-19 is either prior to having any tests that were positive for COVID-19. So there was one report of one person just having sudden hearing loss and no other symptoms of COVID-19. And then they tested positive later. Another possibility is that some of these therapeutics are ototoxic, and I'm going to go into that a little bit more about ototoxicity and the different medications that are being used right now for therapies for COVID-19. So because he received remdesivir, people were kind of speculating, well, was it the medication that caused the sudden hearing loss with the tinnitus, or, was it COVID-19? just in my own personal opinion, I feel like this was possibly more related to the COVID-19 than it was the medication, because remdesivir is given systemically. So why didn't he have hearing loss in both ears? So that's kind of something that's interesting. And we know that viruses can attack just one auditory nerve or one cochlea. So you can see a sudden type hearing loss on one side when it's viral in nature. So that was interesting. Next report was out of a review article in AARP, and it was published on August 28th, 2020. This is talking about a report from Dr. Elias Michaelides, and I'm sorry if I'm saying that wrong, but I will put links to all of these articles in the description of the video. He is the medical director of audiology and otolaryngology at Rush University Medical Center in Chicago. So he reported that it is common for any upper respiratory viral infections to impact hearing. And he reported that it's more common to have the virus impact the middle ear. So you see otitis media or fluid building up in the middle ear. And these are not typically permanent hearing losses. They are medically managed. And this is not the sensorineural hearing loss that we are seeing with some of the COVID-19 patients. In the International Journal of Audiology in the United Kingdom, they conducted a survey of 121 people who had recovered from COVID-19 or had COVID-19, and 13% of these patients complained of changes in hearing and or tinnitus, which is ringing in the ears, like I mentioned earlier, since their COVID-19 diagnosis. So, and that was reported at the 8-week mark post-diagnosis. So 13% is quite a lot. Again, this is just a survey though, and I didn't see the actual survey. I don't know. I'm pretty sure it reported that they had no hearing problems prior to the diagnosis. So this is the most substantial collection of evidence that we have that COVID-19 could possibly affect hearing. Again, we don't know how many of those people received which type of medications. So we don't know if it's medication related or if it was, something that happened prior to onset. There was another report that this author had talked about of an older patient that had experienced deafness with loud tinnitus even after the other symptoms of COVID-19 had gotten better. And this is out of the Mayo Clinic proceedings. There was also a similar case reported in the American Journal of Otolaryngology. So kind of interesting that they're reporting, sudden hearing loss with loud tinnitus after COVID-19. Also, some Johns Hopkins researchers found that SARS-CoV-2 was actually found in the middle ears of some COVID-19 patients who unfortunately passed away. And they were not specifically looking for this in that study, but it was found to be in the middle ear bones of the patients with COVID-19. So we know that it can make its way to the ear, and that's common with any kind of upper respiratory infections. They go up the eustachian tube through the back of the throat and into the middle ear. So, and then that can sit right on the membrane to the cochlea and possibly transfuse. So that is very possible. And there was an associate professor of otolaryngology at Johns Hopkins, head of medicine. His name is C. Matthew Stewart. He said, quote, "If there is an active viral infection in that part of the body, you could get the whole host of symptoms associated with other types of viral infections in that area." He postulates that this could cause inflammation in the ear, and that can lead to impaired hearing, causing dizziness and tinnitus. Still, though, he determined, and other people have determined, that there's not enough evidence yet to draw a link between COVID-19 and hearing issues. So I want to make that clear. There's not enough evidence yet, but Stewart indicated that we can be reasonably suspicious at this point. So that is definitely marked. But it also needs to be addressed that medications used to treat COVID-19 can impact hearing, such as remdesivir, chloroquine, hydroxychloroquine. So those are 3 separate medications. They are ototoxic, which means that they can damage the inner ear. So the question is it a viral cause or is it an ototoxic cause that's affecting hearing in COVID-19 patients? When you're so busy trying to save someone's life and they're on a ventilator, and the goal is to just get them past the virus and healthy and out of the hospital, sometimes complaints of hearing go unnoticed or unchecked. It's not until the patient is feeling better that they then notice that their senses have changed. And we know that it can impair sense of smell, sense of taste. So it makes sense that it could possibly affect sense of hearing, right? And also balance, because our balance organ is next door to the hearing organ. So I just wanted to go over the treatment. What do we do to treat sudden sensorineural hearing loss? According to WebMD, immediate steroids are the best treatment to improve prognosis. So I'm not going to go into the type or the delivery of the medication because I'm not a medical doctor, but it is an emergency and you should see an ear doctor as soon as you have symptoms of a sudden sensorineural hearing loss. There is a critical time window to receive medication to make that hearing loss possibly relieve or get better. The next couple of things I'm going to talk about are just kind of the remnants of other, research that I found online. So this was published in August 2020 out of the Healthy Hearing, and they reviewed the research evidence via case studies for sudden hearing loss and tinnitus. So with COVID-19. So this can be a symptom or complication, but again, this is where I found that older coronaviruses like SARS and MERS did not have hearing-related symptoms. But sudden hearing loss is rarely reported as the onset of a COVID-19 diagnosis. So sudden hearing loss is rarely a symptom. In June 2020, there were several Iranian patients who reported monaural hearing loss, meaning one ear hearing loss, and vertigo. And then there was one Egyptian man with no other symptoms of COVID-19 but sudden sensorineural hearing loss. And then he tested positive. So we do have, just one instance in the research that I could find where someone had a sudden loss, had no other symptoms of COVID-19, and then tested positive. So we don't know how much of this is happenstance or just correlations or just random things that are happening. So bottom line, we need more research to fully understand how the coronavirus affects hearing and balance. And then also, what are the prognoses for these people that develop the sudden loss and the tinnitus? I think that I saw one where someone was treated with steroids after developing that sudden loss, but he only recovered some of the hearing back. It wasn't a full recovery. So again, time is of the essence. If you happen to be recovering from COVID-19 and you notice a change in your hearing, you need to report that to your ear doctor and or your primary care right away so that they can get you to an ear doctor, and maybe reference this video if they need a quick brush up on the current evidence for the relations or links between COVID-19 and hearing loss. All right, people, that's the end of the video. I hope you enjoyed this. And as more research unveils, I will go ahead and continue to make some updates for you. Let me know what other videos you would like to see on the channel. Dr. Rose loves to help you here. Thank you so much for watching, and I'll see you again sometime. Some people call me an audiologist. Others call me a hearing nerd. Being human with hearing loss is like my superpower. As a hearing doctor, I get to help people hear their best while learning about the mysteries of hearing.